Seizure with Mnemonics. What is a seizure? 1. Simple explanation. Think of a seizure as a brainstorm, a sudden, unexpected electrical surge that disrupts normal brain activity. 2. Key concept. Uncontrolled electrical disturbance, leading to temporary changes in movement, consciousness, sensation, or behavior. 2. Epilepsy. A chronic seizure disorder. 1. Mnemonic. Epilepsy equals recurrent, unprovoked seizures. 1. Think. There will be seizures again. 2. Simple explanation. Epilepsy is not just having one seizure. 2. It's when you have a tendency to have repeated, unexpected seizures. 3. Classification of seizures. Think FAG. 1. Mnemonic. FAG. Focal. Starts in one place, aware, impaired, general, all over. 1. Focal, partial, seizures. Memory aid. Focal equals focus, starts in a specific place in the brain. Focal aware seizures. Simple partial, mnemonic. Simple equals staying conscious. Key concept. You are awake and aware, even though you might have strange sensations or movements. Think twitching, strange sights, smells, or unusual feelings. Focal impaired awareness seizures. Complex partial, mnemonic. Complex equals consciousness changes. Key concept. Consciousness is altered. You might seem spaced out or do repetitive things without knowing it. Think staring, lip smacking, picking at clothes. Focal to bilateral tonic-clonic. Think domino effect. Starts as a focal seizure and spreads into a full-body tonic-clonic. 2. Generalized seizures. Memory aid. Generalized equals goes everywhere. Involves the entire brain. Tonic-clonic seizures. Grand mal. Mnemonic. Tonic equals tense, clonic equals jerky. Key concept. A dramatic seizure with stiffening then jerking of the whole body. Think full body storm. Absence seizures. Petit mal. Mnemonic. Absence equals absent, loss of awareness. Key concept. Brief periods of staring and loss of awareness. Like zoning out, often in kids, easy to miss. Myoclonic seizures. Mnemonic. Myo equals muscle. Think quick muscle twitches or jerks. Key concept. Quick, jerky muscle movements. Atonic seizures. Mnemonic. Atonic equals atoneless, loss of muscle tone. Key concept. Sudden loss of muscle tone resulting in a fall. Tonic seizures. Mnemonic. Tonic equals tense, muscle stiffening. Key concept. Brief muscle stiffening IV. Causes of seizures and epilepsy. 1. Mnemonic. GRIMIWI for causes. Genetic, result of structural issue, imbalances, medical issue, infections, idiopathic, withdrawal, injury. 2. Simple explanation. Think of these triggers, genetic factors, inherited predispositions. Structural brain abnormalities. Things that change brain structure, tumors, injuries, scars from strokes, infections. Metabolic, electrolyte imbalances, body chemistry issues, low blood sugar, low salt. Infections. Things like meningitis or encephalitis can trigger seizures. Withdrawal. Coming off certain drugs or alcohol. Idiopathic epilepsy. No clear cause. Sometimes. The diagnosis of seizure disorders. 1. Memory aid. Think HEB history, exam, brain tests, detailed medical history. Key information from the patient, family, physical and neurological exam. Testing to assess their functions. Electroencephalogram, EEG. Think brainwave test, brain imaging, MRI, CT. To look for structural issues, blood tests. To check for metabolic issues. V. Treatment of seizure disorders. 1. Memory aid. Think MEDS. 1. Medication. Eat, diet, device, surgery. Anti-epileptic drugs. AEDs. Main treatment to control brain excitability. Key point. Might need a trial and error approach with medication. Ketogenic diet. High-fat, low-carb diet that can help in some, especially kids. Vagus nerve stimulation, VNS. Device that sends signals through a nerve to the brain. Responsive neurostimulation, RNS, implantable device that stops seizures as they begin. Brain surgery. May be an option for some when medications aren't working. 7. Management of seizures, first aid. 1. Mnemonic. SPRT. Stay calm, protect, roll, time. 1. Stay calm. Reassure the person. 2. Protect. Move dangers, don't restrain, don't put anything in the mouth. 3. Roll. Turn them on their side to prevent choking. 4. Time. Stay with them until they are fully awake. 8. Complications of seizures. 1. Memory aid. Cease, status, injuries, SUDEP, social and emotional impact, status epilepticus. A long or continuous seizure is an emergency, injuries. Falls or injuries from the seizure. Sudden unexpected death in epilepsy, SUDEP. A rare but serious risk, cognitive, psychological effects. Memory, focus, and mood changes can happen. In summary. 1. Main takeaway. Seizure disorders, epilepsy, involve recurrent, unprovoked, brainstorms, seizures. 2. Key points. Understand the FAG, focal, aware, general, types. Look for underlying causes. Use a HEB approach to diagnosis. Utilize MEDS approach to treatment. And know what to do during a seizure. SPRT tips for remembering. 1. Use associations. Link the mnemonics and memory aids to familiar things. 2. Create visuals. Draw mind maps or diagrams. 3. Practice. Test yourself regularly. 4. Explain out loud. Teaching others helps you solidify your understanding.